And welcome back. You're still watching Beautiful Day. This is Weather HQ. Now, in flood-prone communities, invisible threats like leptospirosis and schistosomiasis lurk in murky waters. Now, a breakthrough from Filipino researchers offers hope. A rapid on-site test kit from CLSU and the DOST PCHRD that detects these deadly diseases in under an hour. Now, to learn how it works and how it can save lives this rainy season, we're joined via Zoom by Aldrin M. Corpuz, a Project Technical Assistant 2 at CLSU. Magandang umaga, Aldrin. Welcome to Beautiful Day. Aldrin, could you hear us?
Good day everyone po, especially to our host and to all our viewers listening of Beautiful Day. I am Aldrin M. Corpus from Central Luzon State University,
Aldrin,
University Research Program Office, and I'm here on behalf of our project leader, Dr. Rubihilda Ferguson Alili. Thank you for giving us the opportunity to be part of your morning.
maraming salamat, Aldrin. Let's start off first with yung project po ninyo. Of course, these rapid on-site test kits. Let's take a look first at the problem you're trying to address. Bakit kailangan ng rapid on-site test kits? What are the biggest gaps that you're trying to fill?
Our technology started po a partnership when PCHRD has recognized the urgent need for a faster and more accessible disease detection tool, especially in disaster situation. CLSU's Molecular Biology and Biotechnology Laboratory had prior experience in developing field-ready biosensors for agriculture and health. Seeing this capacity, DOST, PCHRD tapped us under disaster risk reduction and management for health programs to create detection kits specifically for schistosoma japonicum and leptospira, which cause serious public health threats during flooding po.
Gaano katagal usually yung proseso trying to detect leptospirosis compared to, if I'm not mistaken, 45 minutes using these rapid test kits? Normally, how long does the process take? And how quickly can we get results with yung rapid test kits po ninyo? And yung accuracy po niya, at what percentage are we looking at?
Traditionally, when we test the actual field, it takes days, especially on sample processing up to transport to specialized laboratories. So we wanted to solve that problem of not knowing early enough if the flood or environmental waters are contaminated with the disease po. And our technology addresses these problems wherein it can take about less than an hour to detect schistosoma japonicum and leptospira that causes schistosomiasis and leptospirosis respectively.
So it tests yung flood water po, no, for the presence of these diseases. When we take a look at yung accuracy po nito, do we have a number on how exact this test kit is? Kung may percentage po tayo of accuracy to actually determine the presence of these viruses?
During our R&D, we analyzed the specificity and sensitivity of our biosensor. We compare it po to our gold standard molecular-based detection, which is the PCR or polymerase chain reaction, and it shows that it is comparable with the gold standard. So we are confident po that we can detect the actual disease directly on the flood water.
Let's talk about schistosomiasis here kasi in terms of yung layman's terms, leptospirosis, talagang palaging pinag-uusapan. But then schistosomiasis, is that something that we have to pay more attention to? Why is that one of the things that was important to be able to detect sa mga flood-prone areas po natin?
Yes po, karamihan sa ating mga kababayan hindi aware kung ano ang schistosomiasis. This disease is common in regions like Eastern Visayas, wherein most of parts of Leyte and Samar is infected or has risk of infecting these diseases. So one of the dangerous factor sa sakit po nito is that this parasite can penetrate our skin without open wounds. And ganun po siya ka-devastating, and it took months or years para po malaman ang simptomas ng sakit po nito.
So,
And it is really important for us to detect early so that many of our communities in the place wherein this diseases is present po ay mai-inform agad po na yung specific location po na yun ay may sakit
well,
na,
yes,
na
sir.
maaring
Schistosomiasis, if I'm not mistaken, well, we talk about leptospirosis, palagi natin sinasabi na galing siya sa mga daga or ihi ng daga. We talk about schistosomiasis, saan ito nanggagaling? Where does this particular virus originate from?
ang schistosomiasis po is a parasite. It is a trematode po. Meron po silang intermediate host which is suso. Ang scientific name po niya is Oncomylanus copensis quadrasi. Sobrang liit lang po nito. Kung hindi natin titignan ng malapitan, hindi natin mapapansin. So, they are common po in a damp area or mga mabasang lugar tulad ng irigasyon, mga rivers and lakes po. So, our Filipino people na nagtatrabaho near that area, like our farmers, will likely infect po yung disease na to.
And of course, I'm not going to try to pronounce yung scientific term po ng suso when we talk about where schistosomiasis has come from. But let's talk about yung cost nito. If I'm not mistaken, 4,000 pesos per kit para sa rapid test kit po ninyo. When we talk about yung cost effectiveness po nito, comparing it to current laboratory testing, just what are the differences there?
Conventional laboratory testing can cost more when factoring in sample transport, lab fees, and turnaround time. Sometimes it may reach about 10,000 pesos or more for multiple samples. Our kit can process multiple tests in one go directly in the field and eliminate the cost and delay of sending samples to the distant laboratories.
If I'm not mistaken, it is now under the process for securing FDA approval. May timeline po ba tayo dito? And of course, do we also have a timeline in terms of yung rollout po nito?
We are currently conducting pilot scale testing and pre-commercialization evaluation with our partner agencies. FDA evaluation is part of our roadmap, and once the approval is secured, we aim to roll them out first in priority flood-prone areas in partnership with our DOH regional offices.
Has there been any partnerships already at least being talked about with certain LGUs? You mentioned nyo po that you already have a partnership with a government organization. But when it comes to specific LGUs po, may nag-reach out na po ba?
During the 8th National Research and Development Conference happened last July in Manila Hotel, some of our LGUs in Metro Manila like Pasig has reached out to test our biosensor para po to have a surveillance in their location. And also in terms of schistosomiasis, Eastern Visayas CHD or Health Center for Health Development of the DOH also reach out. We are in continuous communication with them so that once our test kit is released, sila po ang mga unang mabebenepisyohan ng test kit po nito.
Do we have a specific month or maybe even year when it comes to yung rollout po ng project po nito?
We have no definite timelines especially when it comes to FDA evaluation. So the evaluation of the FDA is very rigorous and it took months or years. But we are hopeful with the help of the national government. We are seeking support so that mapapabilis po ang rollout ng test kit na ito.
And of course, gaano ka-importante that, in your opinion, that we actually make more rapid, make more quick, and more accurate yung testing processes natin for yung waterborne diseases, especially sa tag-ulan po na kapag may, well, we all know yung flooding situation, not just in Metro Manila, but even in different parts of the country. Gaano ka-importante that we actually test these waters for public health?
During floods, every hour counts po. If detection take days, contaminated waters may already exposed to more people, increasing hospitalized admission. With the help of our test kit, we can be able to detect immediately and have a strategic planning on immediately warn communities and have some preventive measures so that people may inform. So the increasing number of infected people will maybe decrease.
Ladies and gentlemen, he is Aldrin M. Corpuz, Project Technical Assistant 2 at CLSU. Maraming salamat, Aldrin. Thank you so much for sharing your time and your insights, and good luck with the rollout of these rapid on-site test kits. Maraming salamat po.
Maraming salamat din po.